President, distinguished colleagues, I rise to respectfully lead the debate on the National E-Health Bill 2026, which seeks to establish a comprehensive legal and institutional framework for the development, regulation, coordination, and integration of electronic services in the Federal Republic of Nigeria. The bill was read for the first time in this hallowed chamber on Tuesday, the first day of July, 2025. Mr. President, distinguished colleagues, the healthcare sector globally is undergoing an unprecedented digital transformation. Across developed and emerging economies, digital technologies have become indispensable tools for improving healthcare delivery, expanding access to medical services, reducing costs, and enhancing health outcomes. Nations are increasingly deploying electronic medical records, telemedicine platforms, artificial intelligence AI, mobile health applications, electronic prescriptions, wearable health technologies, and integrated health information systems to improve efficiency and quality of care. Mr. President, distinguished colleagues, Nigeria cannot afford to remain on the margins of this global transformation. Despite significant investments in healthcare infrastructure and reforms over the years, our healthcare delivery system continues to face enormous challenges. Medical records remain largely paper-based, resulting in loss of patient information, duplication of diagnostic tests, delayed treatment, and unavoidable medical errors. Healthcare facilities often operate in isolation, making it difficult to exchange patient information securely across institutions. Distinguished colleagues, furthermore, millions of Nigerians residing in rural and underserved communities continue to face enormous barriers in accessing specialist medical care due to shortages of healthcare professionals and geographical limitations. Mr. President, distinguished colleagues, the COVID-19 pandemic demonstrated beyond doubt that digital health technologies are no longer optional, but essential components of resilient healthcare systems. During the pandemic, telemedicine, remote consultation, and electronic health information systems became indispensable in maintaining continuity of healthcare services while reducing unnecessary physical contact. We saw that during the COVID-19 pandemic, where doctors were treating patients millions or thousands of miles away. However, despite increasing adoption of digital health solutions by hospitals, private healthcare providers, and technology companies, Nigeria still lacks a comprehensive legal framework regulating electronic healthcare services. The absence of clear legislation has resulted in fragmented implementation, inconsistent standards, inadequate interoperability, weak governance structures, and uncertainty regarding legal responsibilities of healthcare providers operating digital platforms. Nigeria faces an uneven distribution of medical specialists, with many rural communities lacking access to specialist consultations. Through telemedicine, patients in remote areas will be able to consult qualified healthcare professionals without traveling long distances, thereby improving access to quality healthcare and reducing pressure on tertiary hospitals. We saw that during the COVID-19 pandemics. Distinguished colleagues, data protection remains one of the cornerstones of this legislation. Health information is among the most sensitive categories of personal information. The bill, therefore, establishes robust safeguards to ensure confidentiality, integrity, and security of patients' medical records. The benefits of this legislation are numerous, but few of them are: one, it will improve access to healthcare services, particularly in rural and underserved communities. It will reduce waiting time in hospitals through digital appointment systems and electronic patient management. 3, it will strengthen disease surveillance and public health emergency response through timely collection and analysis of health information. And last but not least, it will stimulate innovation, create employment opportunities, and contribute to the growth of the digital economy, among others. Mr. President, distinguished colleagues, this bill aligns with the federal government's digital transformation agenda, the National Digital Health Strategic Framework, the National Health Act, Universal Health Coverage Objectives, the Nigerian Data Protection Act, and our broader commitment to achieving the Sustainable Development Goals, particularly Goal 3 on good health and well-being, and Goal 9 on industry, innovation, and infrastructure. Distinguished colleagues, Mr. President of the Senate, this bill represents a bold legislative response to the realities of 21st century healthcare. It provides the legal foundation necessary for building a modern, efficient, and technology-driven healthcare system that will serve present and future generations of Nigerians. I therefore urge all of you, my colleagues, to support this very important bill and allow it to proceed to second reading with the speed of light. Thank you for listening. Thank you, Mr. President.